Audio Jungle.
Okay, so to set up the discussion that over a third of the New York City deaths are not tested, I'm referring to a video I had done before, and there are two ICD codes that have been provided. One is U07.1 and 142. This is for confirmed, means you've taken an actual test of COVID. Point 2 means where a laboratory confirmation is inconclusive or not available. So that's fine. Let's use both of these, but you'll see here the CDC is recommending, and they're not using this. So they're literally intentionally and knowingly not using this extra code, even though there's a separate code for qualifying any deaths that you believe are COVID, but you don't have an actual test for. Now, what is the motivation for not wanting more granular data? This doesn't make sense if you really wanted to find out the truth from a public health policy point of view, because you need the most accurate information. This continues, will COVID be the underlying cause? However, the rules for coding and selection of the underlying cause of death are expected to result in COVID more often than not. So remember, this is from the National Vital Statistics. This is a statement from them, and then we're going to follow up with the CDC, which is what all the medical examiners are told to, that they need to follow the CDC guidelines. Now remember, this is from the National Vital Statistics, and they are proposing here the different ways of confirming or working with ICD codes so that you can have them for both confirmed test COVID deaths and unconfirmed or no test presumed COVID deaths. So right in here they talk about a pending record and being able to at least notate that and separate that out from confirmed ones. So at least there was an intent here by the National Vital Statistics Center to group these into the two categories with the two ICD codes that were provided. But then, as you get down to the bottom here, Division of Vital Statistics, it all goes south. So should COVID be reported on the death certificate only with a confirmed test? And it says should be reported on a death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death. Now, I don't know if they got that from the CDC or if they got it from the other way around, but this is where all the stuff above goes flat out, right out the window. I don't even know why they would even discuss the second code when clearly here they don't even want to use it. And you have to ask yourself, why do they not want to split out the two for confirmed and non-confirmed in terms of an actual test? Why? Why would you not want better data? Well, obviously there's a reason and there's a motive and there's an agenda there. This is the document that it comes from. And this is where it says, well, ideally testing for COVID-19 should be conducted, but it is acceptable on a death certificate without this confirmation. And then let's watch the confirmation from Dr. Birx, who acknowledged this, coming from the CDC.
There are countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. If someone dies with COVID-19, we are counting that.
Okay, so this is what it all comes down to. New York City adds 3,800 probable virus victims to death toll. Let me see if I can get this in here. Kind of goes off screen. All right, so this is from Bloomberg, and this is last Wednesday on April 15th. This is when this big bombshell dropped, and has been conveniently not talked about since, because you're not allowed to talk about it because of this whole pandemic agenda. New York City added thousands of people to its coronavirus death toll to account for victims who died in recent weeks without a confirmed diagnosis. The additional deaths, we're talking totaling 3,778, pushed the city's total to more than 10,000. Almost 60% of the unconfirmed patients died in hospitals, and the rest were at home. Excuse me. Freddie Goldstein, press secretary to Mayor DiBlasio, said Tuesday that the data included at-home deaths of people suspected. Now, the judgment is based on reported symptoms including cough, fever, shortness of breath. Is that, you only get that from coronavirus? There's other coronaviruses that aren't COVID-19 that you will get this from. You'll get from the flu, anything that's acute respiratory distress syndrome, anything that's in the ARDS, usually can give you these types of items. It can also go into a point where there's a mixture of these types with cardiovascular issues. It could be a combination of things. It could be, quite a number of things. And diagnoses that are really at some of the top of the leading deaths that we have in this country in terms of sheer numbers. It's just amazing. This is the only symptoms that COVID-19, I shouldn't even say coronavirus because there's many other coronaviruses, but COVID-19 has. This is completely ridiculous. We are focused on ensuring that New Yorkers who died because of COVID-19 get counted. Now, this is a false statement. When you're saying because, you're saying the same thing as from. And we just saw earlier that we are including in Florida, and Dr. Birx and the CDC, we're including anybody who has it, who dies with it, not just from it. So this is a false statement by the city health, no less the city health commissioner. Yeah, good job. While these data reflect the tragic impact that the virus has had on our city, this will help us determine the scale and scope of the epidemic and guide us in our decisions. That is a false statement. Why? Because you're including data, unconfirmed data, with your confirmed data. You're mixing your data and you're rolling it up. The only way you should ever roll up this type of information is that when you have other data that's granular. I actually work with data analysis and data reporting. It just doesn't make any sense. This is another false. So we have two sentences right out of this person's mouth. They're actually proven false. That information, that type of statement was also in the National Vital Statistics, where they say it's very important to have the best data for public policy, and then they say, oh, by the way, don't tell us any of the unconfirmed ones. We don't want to flag them as that. Let's just group them all together. So, they're lying to you. That's stupid. The city's health department published official statistics on Tuesday, so this would be, I guess, the 14th. Afternoon, reporting 6,589 confirmed deaths. Now, confirmed death still means you were confirmed with a test. They're not counting any comorbidity here. Okay? So, as long as you died with it, with a confirmed test, you're included on this. You understand that this is going to include people that died with it. Now, we know that they died with it because we're going to take them at their word that they're confirmed tests. They died with it, but we don't even know if they died from it. So never mind the part where we're including people that have an unconfirmed, that are not confirmed with an actual lab test, something called science. We actually need to go deeper and granular. We really should be being able to determine those death certificates that were given where the patient was died from it, as opposed to dying with it. And if you're there treating the patient day after day, hour after hour, there's a good chance that you can have a better grip on defining that within those two items. And if you notice, that goes back to what Dr. Burke said, if you think I'm full of it. So Dr. Burke said in other countries that if you have an underlying heart condition and you come in and coronavirus gives you it takes your heart condition and makes it worse and you actually die from that, or if it's a liver condition and it helps contribute to that. She said other countries are saying that you died really because of the liver disease that you had, or the heart disease. And she said, well, we're not doing that. So these here confirmed ones should be split as well, because there's going to be ones where people died certainly from this. And she just confirmed out of Dr. Burke's mouth that people are going to die with it. So with and from is not the same. So those should be split out into, and then add the third part, which would be suspected but unconfirmed. I have no problem keeping a track of that, but you can't group all these together. So now you've actually taken 3 parts of data and you've rolled them up into one. So this is fake news. This is false, awful, exaggerated reporting of data that's driving our public policy and putting tens of millions of people out of work. This is total insanity. And can they really be this stupid, or is this intentional to cover themselves? I'm finding it difficult that they're actually this stupid. So here we go. The unconfirmed presumed victims represent 36%. This, of course, is as of April 15th. 36% of the related deaths in New York. 36% didn't have a confirmed lab test. That's over a third of them. And then out of the 64%, we don't know which ones died from it versus those who died with it. Do you see how this number can precipitously drop? If we want to extrapolate that, I don't know if other states, to what degree they have are mixing up their data here, but we had another video where Florida Department of Health said that if you die with it, you're going to die from it, according to our statistics. And the CDC guidelines are like, if you're assumed, you saw that from the national, if you're assumed, so there's no reason not to believe that this is happening everywhere. Is every other place hitting the 36%? I don't know. Maybe they are. There's something else to factor in here, and this is being a different video, is that out of all these deaths, we have to get into the subject of providing the wrong protocol of using ventilators early on these people and killing them up to 80 or 90%. Many doctors have reported that the ventilator death rate on COVID-19 is double than what it usually is, from 40 to 50% during ARDS. And this is another unbelievable story here, that they had the wrong protocol, and I want to know how many hundreds, if not thousands of people possibly were killed because of that. You keep factoring all these things in here, this number keeps getting smaller and smaller and smaller. And there's no doubt, we know that people have died from this, and a certain number of people are having an unbelievable reaction, sort of an overblown autoimmune reaction. This thing is totally real. It's not fake. It's its own disease. And even though it's somewhere in the flu numbers, but for certain people, it certainly is either takes them to within 3 feet of death or puts them over the edge. So there's no question that that's happening. But this is all about fake news, exaggerating, cover your ass, and all types of destruction to our entire country on something that is, according to the rates that have been projected, completely false. I just can't believe that 36%, it's that high. Even before this number came out, I figured it would be like 10%. Had no idea it was going to be like this. Quote, there's no question. This is DiBlasio, this is the mayor. This isn't me. You know, when I say this or other people say this, they get called. This is Mayor DiBlasio. There's no question in my mind, and the doctors can speak to this, the driver of this huge uptick in deaths at home is COVID-19. I guess they're clairvoyant. They can figure out, they can do science in their brain and figure out, you know, all of a sudden, you know, this sounds awfully like global warming BS. And some people are dying directly of it, and some people are dying indirectly of it. So there you have an admittance that they're not the same. But here's the thing. Everywhere you go and look, are they not providing these numbers to you as if they died from it and it's confirmed? That's the characterization, either implicitly or quite often explicitly, using the word from. It's a lie. It's fake news. And it's fake statistics. And they've turned this whole thing into a religion, and it's destroying our country economically. You have tens of millions of people who, them and their families, are flat out on their asses, and giving them a couple of $1,000 ain't going to do anything for them, because if nothing's coming back, and to keep pushing this as a religion, being pro-COVID is insanity, and some people need to be held accountable for this. And this is my favorite part. He went on, this is DiBlasio, quote, we should count them towards a total as quickly as we can, get the full facts about them and include them in the demographic data. What BS? How are you going to do that when you're wanting to commingle all these data groups into one and keep reporting them as one instead of having them split? This is another lie. Just like his Freddie Goldstein said above. Is it Freddie? Yeah, it's Freddie Goldstein. What a bunch of nonsense. I mean, this is, come on, man. This takes a 5-year-old to figure this stuff out. Continuing, this is the same day or the day after Trump claims New York City inflating its coronavirus death toll, because they are. This is a fact. It's a proven fact that you're expanding the scope to unproven tests, guesses, assumptions, and even mixing in directly and indirectly admitted from the mayor himself. You can't do all this and then not claim that the numbers aren't exaggerated. It is a fact that the numbers are exaggerated. Deal with it. Stop lying. And Trump here, over 3,700, the latest figures, and then basically Trump is given in here politically. I see this morning where New York added 3,000 deaths because they died rather than a heart attack. They say heart attack caused this. But if you look at it, that is it. Everything we have is documented and reported great, which is bullshit. What they are doing is just in case. That is okay. We have more cases because we do more reporting. Obviously, that's a false statement as well. They're doing less reporting because they're growing everything up. So Trump here giving into the politics of it, which is pretty sad. You're shutting down the whole country based off of admitted fake numbers. They're not even denying that they fake it. So they fake the numbers, and then they tell you can't report that their numbers are exaggerated when they just told you that they're exaggerated. And just following up on something else, and these are from mainstream news, USA Today. Unproven tests, inaccurate results, public health labs worry bad data could taint U.S. recovery. Well, you think? This is an article that basically gets into the actual testing, not into the deaths. So this is a bit of a separate issue. But, well, separate, but it goes along the same lines. In other words, this gets into where the reported infected might be a higher rate than might be, because the lack of accuracy with many of the tests that are out there for confirmation. Companies are lining up to market an emerging type of blood test. Of course, you can make a bunch of money off of this to detect whether a person has had the coronavirus. These antibody tests could be critical to blah, blah, blah. Some lab experts warn relaxed rules by the FDA, cha-ching, allow unproven and potentially unreliable tests on the market. Oh, no way. Companies marketing 90 antibody tests have notified the federal agency of plans. Now, do you really think all of them are all on board with the most perfect accuracy when there's so much money to be made here? Oh boy. The FDA will review the antibody tests in light of accuracy concerns raised by, we trust the FDA. Oh my God. Officials at the APHL, which is where is it? I just saw it. It's right here. Association of Public Health Laboratories acknowledged accurate and reliable antibody tests are an important tool in the nation's pandemic response, but the wave of unproven tests sold through doctors' offices or elsewhere might do more harm than good. We now have at least 90 tests on the market, and we don't know about the accuracy. Quote, well, somebody actually made some sense here from the APHL. Quote, having many inaccurate tests is worse than having no tests at all. Just remember, that's another reason why they want tens of thousands of people tested, so they can find more and more of this, and they can keep perpetuating the destruction of our country and people's lives to get them onto this more socialized plans and just to beat everybody down and to like take away their freedoms. It's really demonic. So these tests are antibody tests as opposed to the molecular versions administered with a nasal swab. Apparently those are the most accurate. Anyway, this article goes on and talks about we don't know how accurate these are. They could be giving. It doesn't go into detail on false negatives or false positives.